part of other things that the SCORE report, which you've just mentioned, also highlighted will be the fact that lack of data worldwide has limited understanding of true mortality rate, the true mortality impact of the COVID-19, and this has undermined response planning. Can you please help us shed more light on this, especially, we're going to be using Nigeria as a case study because that is where we are. So how truly has this undermined the power of planning, the impact of COVID-19?
Yes, so just as you said, for the WHO SCORE report, like you mentioned, again, going back to this data, we do have data, but what is the quality of the data that we have? How relevant is it, to our situation right now, and to the country in general? Is the data that we have, is it timely? These are some of the issues around having good quality data that would help in planning, and that is what the SCORE. So you see, when you look at SCORE is an acronym for interventions to better with health information system gathering, for countries, and that is why WHO has recommended it for countries, so that we would eventually have better health systems, for our plannings for present pandemics and future pandemics. And what does SCORE mean? SCORE means survey. The first element in SCORE is survey. What are we surveying? We are surveying population. We are surveying population health risks. So in Nigeria, for instance, when was the last time we had a population census, for instance? Because one of the things the report says is that post-enumeration surveys should be done, and that is a survey of sampling a particular sector of the population to ensure that the quality of the census report is accurate. So how often? A census should be done every 10 years. When was the last time Nigeria had a census done? So that helps. So that's one. Then when we go to the second element of the SCORE, counting births, counting deaths, counting death rates. Counting births, deaths, and registering or recording the cost of death. Because that is important for planning. For instance, in this COVID period, when we are saying, when we have patients dying from other diseases outside COVID, but we know that COVID infection has also brought about comorbidity and unintended consequences. So there are some people, because people who have asthma, they were not able to access health institution, their healthcare facility because of probably restrictions and fear of contacting the virus. Are they able to access the health system? And when they passed on, what was the cause of death registered as or recorded as? These are the things that really can, model up and not give us a clear picture when we are talking about data. And that is why it says that the data has to be relevant and it has to be accurate. And then that takes us to the whole part of the SCORE, to optimize data. So it's not just about taking data, but optimize it and then go to review it to ensure that the data we have is actually accurate, so that we can use it for planning, like in this instance, for planning for instance, in Lagos State. Let's take Lagos now, where we have over 14 million people. We know that our infectious disease center that we have in Yaba, we know the capacity it has. But we then know that we now needed to plan, just as the government did, we needed to plan to have to increase the capacity, because we know that a population of over 14 million, that facility would not be enough in a time of crisis. Right. And then you see them going on to plan, they're going on to plan for isolation centers, and from other isolation centers to even having isolation centers, adult isolation centers in different local governments. So that's one of the ways data helps us to plan. Right. Another way data helps us to plan, if we have good and accurate data, for instance, for the demographics of people in the country. For instance, if we're planning for the vaccines to come, and if we look at the country of over 200 million people, how much are we going to spend on vaccines? Who are we prioritizing? Are we prioritizing the frontline health workers? Are we prioritizing the vulnerable member of the society, of the country, where we know that for people who are older than 55 years old, at least our population, we have about 7.5% of our population older than 55 years old. So are we going to be focusing on that population at first, as long in conjunction with the frontline health workers that we also know from our health records? This is also going back to data, because how many people do we have working in the health centers who are actively seeing patients? When we talk about doctors, nurses, our cleaners, our pharmacists. So all of that is those are some of the ways that data helps us, to plan ahead.
All right. I mean, you took practically all my questions in one thread. That's fantastic. But then let's quickly take a look at how data helps the populace to trust government in providing adequate healthcare facilities. I mean, you just mentioned vaccine distribution, whether or not we will be prioritizing, of course. So let's quickly, with the little time that we do have left, how can government use data to buy trust again from the people? Taking COVID-19 as an example, sometimes we're not able to, it's difficult to know how many people we've really tested as a country, because sometimes we have figures and we're not sure if those figures have been updated or not by the NCDC. So very quickly, how can government begin to use data to find trust back on the minds of the people?
Yes. Good, very, very good question. And again, it takes me back to the SCORE report, from WHO for 2020. And one of the recommendations is that the data that we have would help us disaggregate, information and reduce health inequalities and health gaps. So how can data help us to help trust the government? When we have data, for instance, from what we are having, at least we learned from Ebola. The data that we got from the times of Ebola helped us to better prepare for
the COVID-19
for this current pandemic, COVID-19 pandemic. And you would see, a case in point, Taiwan, as a country, I say country because of the controversies, in reviewing that country, you will have seen how well they have done from what they learned in 2003 from when they had the SARS epidemic. And in this COVID-19 season, during the first wave, they only lost 7 people to COVID. A population of almost 24 million. They had less than 500 infections. How? Because they were able to use the public health interventions, to enforce, restriction rules to help people to do the right thing. And so in that environment, in that population, they were able to trust the government in the rules that they enforce, and it helps the people. And in that same light, here in Nigeria, the data that we have, that we know that, okay, people are dying, especially with the way NCDC continues to show us, daily figures. They show us daily figures of death rates. They show them. And so for people who do not believe that, COVID is Nigeria, and who believe that it's a propaganda, at least when you go to the NCDC site and when it is being shown every time, you know that really real people are dying.
Okay.
Real people are dying, so you need to take precautions. And when people begin to see that, then they begin to trust the initiative of the government or the interventions of the government in ensuring that, all these health problems are being well taken care of.
All right. We'll have to drop the conversation here this afternoon, Dr. Anne Olowu. We do hope that when next we call on you, you will oblige us.
Absolutely.
Thank you so much. Thank you very much. All right, we've been speaking with Dr. Anne Olowu. She's a public health physician from Health Boxes. Again, thank you so much for coming on the show.